The most destructive thing you can say in therapy. It's a bold claim, right? There's one phrase so harmful, it can undo months of hard work in an instant. In this video, I'm going to reveal this phrase and 3 others that you should never say to your therapist or psychiatrist. I'll explain why they're so damaging and what they show about your mental state. By the end, you'll know how to make your therapy sessions more effective than ever before. And who am I to peel back the secret psychotherapy curtains? My name is Dr. Salman Aziz Mirza, triple board certified in adult psychiatry, child and adolescent psychiatry, and addiction medicine, and I should probably send these out to my patients before starting with them. Wait, let me actually... You know that feeling when you're about to say something but you hesitate? That split-second decision can make a big difference in therapy. Today we're going to talk about how lying or leaving out details can hurt your progress. When we go to therapy, we want to feel better. But sometimes we might not tell the whole truth. We might think it's no big deal, but it can really mess things up. Imagine you're building a house, but you don't tell the builder about a crack in the foundation. The house might look okay for a while, but it won't be strong. Let's use a totally fictional character for storytelling purposes, and let's call her Sarah. Sarah may come to therapy for feeling sad and lonely. She talks about her relationships, how awful work is, how she's still struggling with feelings for her ex, but she never mentions her nightly 6-pack of beer habit because she doesn't think it's important. However, when it finally comes out in therapy, her therapist can help her realize it's actually a big part of her problems. Research shows that being honest in therapy helps a lot. People who tell the truth about their feelings and experiences do much better in therapy. It's like giving your therapist all the pieces of a puzzle. With all the pieces, they can help you see the big picture and find the best way to solve those problems. Now, you might be wondering what kind of lie could be so bad. Well, there's one that therapists see all the time. It might seem small, but it can really slow down your progress. Any guesses? Well, it's about homework. Yep, therapists often give homework, like keeping a journal or trying new ways to deal with stress. Lying about doing your therapy homework is a big problem. When you say you did the homework but you didn't, it shows you might not be fully committed to getting better. It's not about making your therapist happy. The homework is for you. It's a chance to practice what you learn in therapy in real life. When you don't do it and lie about it, you miss out on that chance to grow. Plus, it can make you feel guilty, which isn't the best for your mental health. Speaking of growth in therapy, there's one thing you might be doing that's holding you back. It feels like the right thing to ask, but it's actually slowing down your progress. Want to know what it is? In therapy, it's important that you feel in control of your own healing. This is called client autonomy. But sometimes clients can rely too much on their therapist, which can create problems. Let's talk about good old Sarah again. She came to therapy feeling stuck in her job. Every session, she'd ask her therapist, "What should I do?" She wanted her therapist to tell her if she should quit or stay. But that's not how therapy works best. Sarah's constant questions for direct advice were holding her back. When clients always ask for direct advice, it can stop them from developing their own problem-solving skills. It's like always asking someone else to solve a puzzle for you. You might get the answer, but you don't learn how to solve problems on your own. Research shows that when people lead their own change in therapy, it works better. When clients set their own goals and explore their own feelings, they tend to have better outcomes. So what's that question that makes therapists cringe? You've probably guessed it by now. It's, what should I do? This simple question can actually slow down your progress in therapy. The most effective therapy happens when you and your therapist work together as a team. Asking, what should I do, might seem harmless. After all, isn't that why you're in therapy? To get help? But here's the thing. Your therapist isn't there to make decisions for you. They're there to help you understand yourself better so you can make your own choices. While asking for direct advice can hinder growth, there's another common mistake that's even more damaging. It's a tiny assumption that can lead to big misunderstandings. Have you ever felt like someone was reading your mind, but they got it all wrong? This happens a lot in therapy. We often think that our therapist knows what we mean without us saying it. But this can cause big problems. In therapy, assumptions can create misunderstandings. When we don't explain our thoughts clearly, our therapist might get the wrong idea. This can slow down our progress or even set us back. Let's leave Sarah out of this one and talk about another totally made up character, John. John went to therapy feeling sad. He told his therapist, "You know how it is when your family doesn't get you." John assumed his therapist knew exactly what he meant. But the therapist didn't know John's family situation, leading to a misunderstanding that wasted several sessions. Research shows that these misunderstandings can hurt therapy outcomes. It's like trying to fix a car when the mechanic thinks the problem is the engine, but it's really the brakes. When clients and therapists have different views of the problem, therapy is less likely to help. So, what's the most damaging assumption in therapy? It's hidden in a simple phrase many of us use without thinking. This phrase can block real connection with your therapist. Can you guess what it is? The phrase is, "You know what I mean." These 5 words might seem harmless, but they can cause big problems in therapy. When you say this, you're assuming your therapist knows exactly what you're thinking or feeling, but they don't. Even if they've heard similar stories before, your experience is unique. I joke about this all the time with my patients when I say, "I'm a psychiatrist, not a psychic." While assumptions can slow progress, there's one statement that can bring therapy to a screeching halt. It's short, but its impact is huge. It's a phrase so harmful that it can undo months of hard work in just a few seconds. This phrase attacks the very heart of therapy, the bond between client and therapist. That phrase is, "You don't care about me." Let's bring back John for this one. John has been seeing his therapist for 6 months. One day, feeling low, he says these 5 simple words. With this statement, John puts his whole therapy at risk. This phrase ultimately shows a lack of trust in the therapist. It can make them feel hurt or defensive, damaging the relationship that's crucial for healing. Research shows that when clients question their therapist's care, it can often lead to worse outcomes. Clients might feel stuck or even quit therapy, losing all their progress. People might say this out of fear, doubt, or as a test, but it puts a therapist in a difficult position. They can't simply deny it without seeming insincere, yet not responding well can worsen the situation. And ultimately, the phrase is often untrue. Therapists typically care deeply about their clients and want to help them. Hearing that a client thinks that they don't care can be very hurtful and destroy that relationship. I often say that trust is like a piece of glass. It's strong, but can be easily broken and then nearly impossible to be put back together again. Saying "you don't care about me" is like throwing a brick at that piece of glass. If you're feeling unsure about your therapist's care, try expressing it differently. Say something like, "I'm feeling unsure about our connection," or "I'm worried you might not understand how I feel." These statements open up a conversation instead of shutting it down, helping to maintain the trust needed for effective therapy. Now that we've covered these harmful phrases, let's talk about how to communicate better with your therapist. First, try to be as open and honest as you can. Remember, therapy is a safe space where you can share anything. If you're not sure how to say something, it's okay to tell your therapist that. Think about your therapy between sessions. Know what worked well and what didn't. Share these thoughts with your therapist to make your sessions more helpful. Therapists and psychiatrists like me can't take a blood pressure reading to measure how things are better or worse. So we all rely on you to let us know how we can help you the best way. Tell us if we're doing something wrong and can do a better job. Lastly, be patient with yourself and the process. Change takes time, but by working on your communication, you're making progress in your mental health journey. Thank you for watching, and make sure to like this video and subscribe to the channel if you learned anything new. Let me know in the comments below what the worst thing you said to your therapist or psychiatrist, or for more fun, the worst thing that they said to you. Whenever I hear some of these, I have to end up putting my head on the table and just take a deep breath. Until next time, be safe and be well.